Now we're going to review the steps on how to treat Bartholin cysts and cyst abscesses using a word catheter. First, you prep the area with iodine swabs to sterilize your site and clean where you are going to make the incision. Generally, we use about 3 swabs to sufficiently clean the area. Then you will apply local anesthesia. We usually use 1% lidocaine, preferably with epinephrine. We are using a 30 gauge needle that is 1.5 inches long. We are going to make the incision adjacent to the hymenal ring, so that's where I will apply the anesthesia. Now I am going to make an incision where I applied the anesthesia using a number 11 blade. The incision is going to be 5 millimeters to 1 centimeter long. This is different from an incision and drainage, which will require an incision that is 1 to 2 centimeters long. You don't want the incision to be too big, or else the word catheter will fall out. Before you take out the scalpel, you will use pickups. These can be toothed pickups or mosquito forceps. And you will grasp the skin and cyst wall before you take out the blade. We can express some of the contents of the cyst or abscess. You don't want to express the contents completely because you may lose the placement of the word catheter. This is how the catheter looks. There's a balloon at the end. You will insert this into the incision site. It should fit into the cavity of the cyst. Once it is in place, you will inject into the catheter about 3 milliliters of normal saline. This is using a 22 gauge 1.5 inch needle. The trick is that you want to place the needle directly into the middle of the word catheter. Otherwise, you may puncture through the word catheter and it will not be useful. My needle is in the middle of the catheter, and I'm going to inject it with saline to inflate the balloon. Now the catheter is in place. It has created another tract for the cyst to drain. We will then tuck the catheter into the vagina, and it usually sits there for 4 weeks, or it can fall out earlier.